Hi, my name is Wasif, and welcome to the Pumpkin Patch, where we talk about adventures in parenting as well as health and wellness. It's presented by Eye Care Pharmacy, where I'm a pharmacist and an owner. So if you have any questions about the podcast or need help with a prescription, you can feel free to text me at 780-705-8871. We provide free delivery as well as expert advice all throughout Edmonton, Sherwood Park, St. Albert, Beaumont, as well as even Stony Plain. So if you do like the podcast, please give us a 5-star rating and hit subscribe. Thanks so much for dropping by, and I hope you enjoy our little conversation. Thanks. Bye. Hi, my name is Wasif, and welcome to the Pumpkin Patch, where we talk about all things in regards to just family health, general well-being. Today I'm joined with Dactin Trent, and I've known Dactin back from the pharmacy days, and he's also studying at UFC, and he's in his second year of learning to become a doctor in the med program there. So thanks for joining us here, Dactin. I appreciate you taking the time to be with us today.
Yeah, hey Wasif. Yeah,
Hey.
nice being back here. Yeah, I'm the old guy in the class.
Yeah.
But hey, Was, one of the things I actually I wanted to add for that previous talk that we did
Yeah.
was in regards to if you do decide to get the shot, right?
Yeah.
Getting that first shot, if you looked into the data that you were mentioning, all that data, that first shot actually, when they say you're 80%, 70 to 80% covered,
Yeah.
for some reason it's not enough, because if you look into the data, all the people that are in the ICUs, I think it's overwhelmingly like 80-90% that people in the ICUs, they either have 0 shots or 1 shot.
Yeah.
Right? So
That's
there's
what
a
I
key
have.
there. Yeah, there's a key there that if you do get the shot, you need both shots, or else your chances of getting infected and being sent to the ICU are going to be much higher, right?
Yeah, that's true. Like when they
Yeah.
quote the numbers of, how our healthcare system is being overwhelmed, they're talking about unvaccinated or people who just got the first shot and not the second. Yeah. So that's an important thing to kind of bring up, just in case you haven't gotten your second shot yet. It'd be definitely a good time to kind of jump and just finish off that series for sure.
Hey, Wes, I got a question for you actually. For pharmacists giving the shots, you know how there is that $100 bonus now? So do pharmacists give out those, like, you don't give out the cards, but what you'll do is, will you register with the government, and then the government sends the patient the money, or how does that work?
No, I don't know how that works, but I kind of briefly looked at it today, and I think they just claim it directly through the government through a website.
Oh, so the patient has to go and claim it, proving basically they got their shot.
Yeah, if you got their first or second shot, in a certain period of time, then they'll give you a $100 certificate there. Yeah.
Oh, okay.
Yeah. So, like, how successful has that program been in regards to that? You think?
I have no idea what's.
It hasn't been very successful.
Yeah.
The $100 incentive wasn't super. It didn't really move the needle, right? Versus, like, have you seen any of the data on just the vaccine exemption? What do they call it? I call it a vaccine passport, but
like vaccine. Yeah, I know we were talking about it earlier.
Restriction exemption program.
Restriction exemption program.
But essentially, I know the government is calling it that, but it essentially works as a vaccine passport. But yeah, like, have you followed, like, other provinces and their rates of when they've introduced that, and how vaccination rates have changed in the introduction of that?
Oh, like giving away free goodies, you mean?
No, not the free goodies, but the how BC and Manitoba, they kind of did like a vaccine passport system. What was their response in regards to vaccination rate?
I have no idea.
You have no idea?
No, I have no idea. I don't follow other provinces because there's too much. There's hell raining down on our province. But yeah, what's going on? What's going on with
Well, the rates amongst people who are hesitant triple, right?
Is that right, eh? Wow,
Yeah,
interesting.
yeah.
How does
And
that
then,
make sense?
well, because it's kind of like I'm trying to find a way to word this where it's not but because it's a sensitive topic, so you kind of have to figure out how to walk it, tread it carefully. But basically, it's kind of a situation where if you want to be able to go dine, if you want to go to the gym, if you want to go to the theater, you have to show that in BC and Manitoba. You got to show that you're double vaccinated, right? Or in Ontario too, right? And people want to do these non-essential activities, right? But the only way that they can participate now is by showing proof, right? And because of that it's kind of changing. I know this word has been used a lot in the last week or so, but the idea of like the social contract, right? This is part of a social contract now of what you need to do to kind of participate in some of these activities, right? And because it's changed the nature of the social contract that we have, more people are getting the vaccination so they can, be able to kind of participate in more activities. Right?
Yeah, actually, when you say that, was now I remember that when France, Macron, I think that's his name, when he wanted, yeah,
I always call him macaroon.
macaroni.
Macaroon.
Oh, macaroon, or well, I guess macaroon is also is that also a French pastry?
Yes, also. Hey, what's the president of France? How do you say his name?
Shit, I don't know who the new president is.
Macron,
but he's not the president.
Macron. He's not the president
anymore? No, not anymore.
Macron.
I don't think he is.
You have to produce a little bit of
saliva. Has a degree in political sciences, so that's why I always ask her.
Oh,
well,
gotcha.
I mean, that's not it. I've got an HR background too.
HR background, yeah.
Yeah, so where I was going with that until we got sidetracked was that that guy when he mandated the vaccine passports, the uptick the next day for people getting the shot was I think it was like 1 million people signed up.
Oh yeah.
You're right, Ross.
And even in Alberta, like they said on Friday, they had like 9,000 people who got the shot.
Yeah.
Then they announced the program, and on the Saturday or the next day, it might not have been the Saturday. On the next day, it jumped out to like 21,000 province-wide.
Wow. Yeah.
Right.
Yeah.
So I mean, it's making a huge impact in terms of at least getting everyone vaccinated and that sort of thing, right? So the way it's working right now is from September 20th to October 25th, you just have to show one vaccination in order to do these non-essential activities. And after the 25th of October, you're going to have to show both in order to participate. And then if you don't want to do that, then you can also do the negative COVID test, as long as you've had a negative COVID test in the last 72 hours. But it can't be through Alberta Health, right? It can't be on Alberta Health. It has to be, it sounds like, I think it's something that's kind of out of your own pocket sort of thing. So you kind of have to go to a pharmacy, do a rapid test, that sort of thing. So, yeah. And then,
so boss, is it can you do rapid too, or is it rapid, or is it PCR?
No, you can do rapid.
Oh, okay.
So it doesn't have to be PCR. And then not all businesses are obligated to. I think the reason why they probably they've called it the restriction exemption program rather than a vaccine passport is not all businesses are required to participate, right? So a business can say, hey, you know what, we're not really going to screen because that's not what we want to do. And so in those cases, those businesses can still operate, but they'll operate at limited capacity. Like for instance, if you're like a restaurant, then it would be kind of you have to operate at for a restaurant you can't do dine-in; it'll only be takeout. Or if you're like a gym, you got to do like 1/3 capacity, that sort of thing. And I know off air you spoke earlier about going to Costco. When you're going to Costco the day before the exemptions and kick in tomorrow. And I know you're just dropping off your car, but how busy was Costco? Costco is always busy, but did it seem especially busy today? Because this would be the day before the restrictions kick in.
Oh, you know what? I went all the way to, it's like in Balzac, the Balzac Costco.
Oh,
So
okay.
it's a little bit, it wasn't one of the ones in town,
Oh,
but the car part of it, getting your tires and stuff put on. Yeah, it was disgusting. The lineup was disgusting.
Oh,
But
yeah.
I'm not really sure about the entrance into the store though. Just thinking about it, I didn't see a lineup, but then again, I didn't really go into the store.
Oh, yeah, they don't. Yeah, they don't. They're not doing. I'm not sure if they're gonna do limited capacity at Costco or not, based on just their own, whatever they mandate. But they don't necessarily have to if they screen. So so I don't know what their situation is.
Yeah, I did get an email from my doggy daycare place where they said that where they're not gonna be participating with what you're talking about.
Yeah.
Just because in their situation they dealing mostly with dogs and there's not a lot of humans in there, right? So you're right. There are some places that don't have to fulfill. Maybe that's why it's not called a passport, because
I think that's why it's
universal.
Not called a passport. Yeah, exactly. That makes sense the way that's kind of worded, that sort of thing. So let's see. So what are your thoughts on in regards to the vaccine passport? Do you think it's will be a good thing overall? I guess so, based on the numbers that we kind of talked about, right?
Yeah, you know what I actually, after you mentioning all those numbers, I didn't know about those numbers, and then after jog my memory about the Macron or the macaroni guy, I wonder why they didn't get like a psychologist or something to kind of look into this, right? What is human behavior like? And you never hear that in the news, but from the numbers, it sounds like, hey, this is a good idea, right? Because it's just going to increase the uptake of vaccinations, and in the end, it's going to be best for the overall public, right?
Yeah,
but you still get your choice though.
Yeah,
right? You're still choosing. You're not forcing people.
Yeah, exactly. So, I know originally they wanted to. I think they were just hoping that $100 gift card would really take off and do uptake, and that was kind of their last resort before going to this exemption program. And it's because it's interesting that the $100 reward didn't really work, but this one that doesn't really have where you're not giving people individual incentives does work, because there's incentives to just participate in other activities in a whole, right? So I think that's really interesting from a psychological standpoint.
Yeah. What I was thinking about that $100 thing, thinking if they really wanted to help out Alberta too, why don't you do something with well, I guess there's vegetarians, but I was thinking something maybe along the lines of giving out free beef or something.
Yeah.
So maybe you edit that part there.
That's fine. You didn't say anything bad. No, I would have loved to see a program I don't know how you would execute this or something like that, but I would have loved to see a program where it probably doesn't make sense, but where for every first person that gets a first dose or whatever at this point, helps to give a nurse a $10 pizza or something, right? Some type of incentive for the frontline worker.
A pay it forward kind of deal.
Yeah.
Jeez, man, that's ingenious, boss. Actually, I because some people maybe they want to help out other people, right? That you need psychologists to kind of study that, right?
Yeah. So I think there's something there. I just don't know what the incentive would be, but I would want for every person who gets vaccinated to kind of pay it forward to the nurses and the frontline staff who are having to deal with this crazy workload, right?
Yeah.
As a way to say thank you to them, right? That's kind of what I wanted to see, but I just don't know how to, that's might take a marketer to kind of figure that part out, but there's something there, right? I think that'd be a really great idea.
Oh, absolutely. Jeez. Holy Wasif, you are quite the thinker, eh?
Yeah,
Honestly, I've never heard that before. But if you think about it, sometimes you read in the news where they have that pay it forward stuff in like the Starbucks line, for example, right? And it keeps on going on and on. And you're not just helping one person, you're helping multiple people, right?
Yeah,
So,
like I was considering running that as a program at my pharmacy, but it's a little bit difficult with the rules and regulations with pharmacy. You can't really incentivize certain services.
oh,
You know
okay.
what I mean? Yeah.
Yeah.
But I wonder if there'd be an exception to that or something to that effect. Yeah.
Yeah, because actually, I had a conversation with a nurse yesterday, and they're getting slammed right now.
Yeah.
What they're starting now too is that there's a thing called mandatory overtime. Have you heard of that before, Was?
No, I haven't heard of that.
Yeah, it's crazy, right? Well, I guess they're forced to do this now, where you don't just get the option of doing overtime. If they call you and you pick up your phone, you're mandated to go in, even if you've just came off a shift.
Oh man, that's
Right.
crazy.
So it's burning
Oh yeah.
out, right?
Oh, it's gonna burn it. Yeah, and the last thing you want to be is burnt out, like taking care of COVID patients.
Yeah. Then you're gonna mess up the procedures of proper gowning and doffing and things like that, right? And then there's a chance you can get infected. So
yeah, exactly.
Yeah, but that's a crazy concept, right? Mandatory overtime.
Yeah. No, our nurses definitely deserve a break somewhere here. So I hope they're, I hope, with this new exemption program in place, we can hopefully, and we'll find out in 2 to 3 weeks, but to have some of these numbers drop and just reduce that stress that we're kind of giving our frontline workers, that'd be great to see.
Absolutely.
Yeah. Well, but thanks again for joining us here, Dax. And then if you have any questions or concerns about the podcast, please text me at 780-705-8871. Thanks, and I'll talk to you soon. Take care.
Yeah,
Bye.
Thanks for having me, Wasif.
No worries. Goodbye. Thanks again for listening to the Pumpkin Patch Podcast. Again, if you do like what you heard, thanks again for listening to the Pumpkin Patch Podcast. If you liked what you heard, please feel free to give us a 5-star rating and subscribe. And again, if you have any questions about the podcast or as well questions about your health or wellness, text me at 780-705-8871. And have a great day, and hopefully we'll chat soon. Thanks. Bye.